apologize. We have to go live now. My name is Foster Mohale. I'm responsible for media relations, the National Department of Health. Without wasting any time, as I've already apologized, I'm going to quickly introduce our members of the panel today. We've got the Minister of Health, Dr. Joe Patla, as usual, who's going to be our key note speaker. We've got the Deputy Minister of Health, Dr. Sunsen Domo. We've got today we've invited the Tourism Business Council of South Africa, which is going to be represented by Mr. Chifiwa Chivengwa. I believe most of people they know him. We've got also our EVDS project manager, Ms. Milani Wolmarans, who's going to take us through the process of the EVDS together with our main issue of the day, which is the digital vaccination certificates. Without wasting any time, I'm going to hand over to the Minister of Health, Dr. Joe Patla, to give us the keynote address. Over to the Minister.
Thank you very much. Thank you very much, Mr. Mohale, our program director for this program. My greetings to my colleague, the Deputy Minister for Health, Dr. Sibongiseni Dlomo. Also greetings to Mr. Chifiwa Chivengwa from the Tourism Business Council. We're very pleased to have you today, as our main featuring item will be the vaccination certificate, which I believe will add a lot of value to your sector. Members of the media, viewers at home and listeners, good morning to all South Africans. It is again our pleasure and privilege to be back to provide updates to the nation on how we are managing the fight against the invisible enemy, the COVID-19 pandemic, and also to report on the challenges still ahead of us, even though we've made a lot of progress, as we'll indicate. Even though we had a few weeks where we haven't had the formal briefings, there have been a lot of opportunities where we have been able to share information from different platforms. Quite often, we spend most of the time also on the ground interacting with members of the society. As usual, we will touch on the epidemiology of the pandemic and also on our interventions, especially our key defenses against the pandemic. And in this case, as we know, a major weapon at our disposal at this stage is the vaccination program. So we'll say quite a bit more about that. It's with a deep sense of relief that I can say this morning to all South Africans that we have indeed exited the long-drawn third wave. When the president spoke to us last Thursday, he did mention this. Indeed, we have exited the third wave, which, as I've said, has been long-drawn. From our scientists in terms of modeling and monitoring indicated that on the 27th of September, we technically exited the third wave, which is really very welcome information. This third wave has lasted much longer than the previous two waves, over 100, close to 110 days, and indeed much longer than the previous waves. First wave, which was somewhere in the region of 80 days, and then the next one around 90 days. So this one, well over 100 days. The number of new infections have been consistently dropping in the last 3 weeks, with a 33% reduction in the last 7 days. There's been also a 19.3% decrease in hospitalization in the last 7 days, a very welcome news, which means that there's potentially a lot of relief for our hardworking health workers. Even more encouraging is the fact that we've also seen serious decrease in the reported deaths. In the last 7 days, we have seen a 51% reduction in the reported deaths, even though every one more death is just one too many. But obviously, we do appreciate when the death rate drops quite dramatically like this at 51%. The overall positivity rate has remained below 5% in the last 7 to 14 days, on an average over the last 7 days of 3% positivity rate. The average positivity rates have also reduced in all provinces, We still have some concerns with the Northern Cape and the Free State provinces, where the positivity rate has, even though it's gone down, quite on a number of days, it has remained above 5%. And this includes the reported data of yesterday, where the Northern Cape and Free State were again at more than 5% of positivity. Also, the other important factor which tells us that indeed we are in better territory now is the fact that the reported reproductive rate of the virus is also below 1, standing at 0.67%, a very important indicator, which again says that we are entering stable territory. It is because of these encouraging declines in infections and stability of the pandemic that our President Ramaphosa, was able to make very groundbreaking announcements last week, reducing a lot of restrictions to level 1, with very liberal allowances, including more numbers of gatherings indoor at 750 and outdoor at 2,000, and also the curfew moving from 11 p.m. to midnight. We join the President in thanking all South Africans who have been resilient in observing the non-pharmaceutical interventions, such as wearing of masks, social distancing, avoiding crowded environments, hand washing, and also sanitizing. It is these measures which have brought us where we are today at level 1 of the adjusted restrictions. We wish to take this opportunity to appeal to all compatriots that please let us not lower our guard at this stage, because of the reduced level of restrictions. We must not think that the pandemic is over. We're just being given a breathing space. It can be longer if we make sure that we behave properly and we avoid the risky behavior, and we observe the personal hygiene and safety measures. Let us always remember that while the numbers are down, the virus remains in our midst. While yesterday we reported only 989 new infections, which is far a lot of progress compared to where we were. Huge improvement from the early July periods, where we are reporting in the region of 20,000 new infections on a daily basis. This virus, the killer virus, is still in our midst. There are still, just to remind us that indeed we are not yet out of the woods, let me just remind you that there are still over 5,000 people in hospital with COVID infection, of whom 885 are in the ICUs and 465 are on ventilators. So this is just a reminder to all of us that indeed this virus is still very strong, it's still there, notwithstanding the lowering of restrictions. We can only sustain the low levels of infection if we continue to observe the personal health and safety measures, which we know very well. We have been with this over 1.5 years now. We want to again salute our gallant healthcare workers who continue to risk their lives while saving lives of others. As we enjoy the relaxed restrictions, let us always keep our thoughts on the healthcare workers, because by keeping ourselves safe, we are also keeping them safe. Now, our vaccination program, which is our most potent weapon against the pandemic, is now firmly on the ground, firmly entrenched in our communities. Thanks to our colleagues, the MECs of health in all provinces, the head of departments, and especially our ground forces, who make sure that vaccination sites are open 5 days a week, and in some instances, 6 days, and in the last week, also 7 days, including on Sundays. I want to take this opportunity also to thank our President, President Ramaphosa, Deputy President Mabuza, leaders of all spheres of government, colleagues, ministers and deputy ministers, premiers, mayors, councillors, leaders of civil society, such as religious, traditional, business, sports and recreation, arts and culture activists, by coming on board over the last weekend of the VUMA weekend, this last weekend. Over this VUMA weekend, we surpassed our minimum target of 350 vaccination doses administered. And I'm pleased to say also that the momentum of the weekend has carried us through into the week, with sustained increases over this week, far better than the previous weeks, from Monday right up to yesterday, with the last 2 days, that is Wednesday and Thursday, again going over 200,000 doses administered per day, which is a target which we had started to miss over the previous weeks. Over 2,100 sites were opened on Friday of the VUMA, 1,400 on the Saturday, and 500 sites open on Sunday. The increased weekend opening gave an opportunity for those who are busy during the week at work, and now they had an opportunity to visit our vaccination sites. More VUMA weekends will be announced in future by our leadership, the presidency. The total doses administered thus far up to yesterday of vaccines are now standing at 18,735,000, very close to 19 million doses, with 13,300,000 individuals vaccinated, which is now, we are standing at 33.4% of the adult population. So this takes us almost very close to half of the 70%, because by the time, when we reach 35%, it will mean we'll be at half of the 70% which we are aiming for. So at least we're getting close to half of that 70 at 33.4%. More encouraging is that the 70% of the more vulnerable groups is within reach, that is the 60+ age group and the 50 to 59 age groups. We are very close to reaching 70% coverage of these elder groups, which are more vulnerable. Now, just to give you the indication, the figures there for the 60+, we are now standing at 60.7%, less than 10% to reach the 70%, with one province, Limpopo, already at 71%, and other provinces very close, the Eastern Cape, the Western Cape, KZN, including Gauteng, and most of our provinces are now very close, as you can see, in the average of 60.7%. So in the next few days, many provinces will actually reach the 70%, and it's up to us to support the provinces which are still lagging behind, so that at the national level we can reach at least the 70% of the 60+. Nationally, just to give you in absolute numbers, we only need to reach another 500,000, 513,000 60+ age group for us to reach the 70%. So when you break this into provinces, in some provinces, we only need to find another 40,000 over 60s and so on. So this is a number which we believe that it's very close to achievement. On the 50 to 59, as I said, we are at 52%, so still a little bit more to go. In absolute numbers of the 50 to 59, we still need to reach another just over 800,000, 50 to 59, in order to reach the 70%. I'm emphasizing this because this is the age group which is at the most vulnerable when you get the COVID-19 function, very vulnerable, risk of hospitalization, ICU, and even death. So we're very pleased that this elder age group, we're making good progress, and we should be able to reach our 70% coverage. We applaud the hard work done thus far by our teams, both in the public and in the private vaccination sites, and we appreciate the partnership with the private sector. We also want to take this opportunity to thank the Solidarity Fund and all those who have contributed to its funding for the invaluable contribution this fund has made in the containment of COVID-19. We know that Solidarity Fund started funding, including the acquisition of ventilators. Also, when we first made a deposit to the COVAX facility for the vaccines, it was the Solidarity Fund which helped us to make funds available. So we want to thank the management, the trustees of the fund, and also all the businesses and individuals. I know that even political parties and individuals, many of us did make some small contribution to this fund, and we hope that it can be kept strong. Now, a major highlight, as I alluded earlier on for today's press briefing, is the launch of our vaccination certificate. This certificate has been long in the making, and we're happy today that we can be able to introduce it to the public formally. I'm aware that over the last 3 days, while it has been in the testing phase, many people have uploaded it onto their cell phones. I've seen on the number of WhatsApp groups in which I belong that the number of friends, comrades have been showcasing their certificates which they've uploaded. But that was really just a sneak preview. Otherwise, the formal public launch is happening this morning. And I'm also aware that in the process of early uploading of the certificates, some people have expressed frustration because of hiccups in accessing this certificate. And today I have the team which is here to be able to answer many of the questions. The certificate was developed in partnership with our department and the CSIR, the Center for Scientific and Industrial Research, which falls under the Ministry of Science and Innovation, Minister Blade Nzimande's ministry. And this is what we are launching today, as the team will explain, is the first phase of the certificate. We say first phase because it is ready for use, but there's going to be a lot more improvements going forward in the next 2 months to improve, especially on the safety and security of the certificate, but it is ready for use. We expect that the certificate will be a tool to enable vaccinated people to access many opportunities which various service providers will be making available. Amongst others, we expect sports and recreation to open up more, and for vaccinated people, shops to provide discounts, and other to give prizes. I've already seen one of the banks advertising some prizes for people when they get vaccinated. Entertainment also to start opening up, music festivals. These are some of the opportunities which we believe that people who are vaccinated will be able to access with observation of all the relevant safety measures. Travel and tourism, and again, Mr. Chilenga will speak more to that. So a lot more opportunities we believe are going to be availed. From our side as the health department, our role is really to make this tool available to the nation so that we can be able to provide people with the proof of vaccination so that they can have access to many amenities and many more activities which many of us have been missing can now be accessed through this certificate. We're also presently happy yesterday. We're very pleased when the UK government announced that it has taken our country off from the red list, meaning more easy travel between people from South Africa and the United Kingdom. But even more exciting for us was the announcement by the UK that they will be recognizing this certificate, which we are launching this morning. So I'm sure many people who have been waiting for business trips, to visit family and friends, to go on study in the UK, will now know that they can do so without having to need to do a 10-day quarantine when they arrive in London and other UK destinations. We call on all South Africans and other nationals in our country to come forward and be vaccinated. We have a window of opportunity now, while infection rates are low, to protect ourselves before the expected fourth wave later this year. The vaccines have proven to be safe and effective. Very few vaccinated people are falling ill, there's ample evidence to this. And if you have any doubts, just ask your nearest health worker. They will be able to tell you that in all the health facilities, very few health workers have been falling ill during the third wave. But also, if you can also ask from the schools, from the educators, you'll get a similar story that unlike the previous waves, very few educators have fallen ill and passed away during this third wave because they were prioritized early in the Sisonke vaccination trials. Over 13.3 million people have now taken the vaccine, as I've indicated earlier, and very few of them have had serious side effects. Many have experienced just minor side effects, but very few have reported serious side effects. We have an opportunity to save our lives and those of others close to us, and also an opportunity to open the country. Now is the time to take your vaccine. Kinako, sekuyisikhathi sokuthi uthathe umgomo wakho. Sibonga kakhulu. Thank you very much, Mr. Mohale and the listeners.
Thank you, Honorable Minister, for the keynote address. Without wasting any time, I'm going to call upon, as Minister has already announced, that today we are launching the digital vaccination certificates, which people have been calling around for the past few days, trying to download certificates. Without wasting any time, I'm going to call upon the EVDS project manager, Ms. Milani Volmarans, to take us through the digital certificates. Thank you. Over to you, Ms. Malan.
Thank you, Mr. Mwale. Good morning, Minister, Deputy Minister, Acting DG, other panelists and members of the media and the public at large. I will be presenting the COVID-19 vaccination certificate, and we'll do a live demonstration on how you could download your COVID-19 vaccination certificate. During the presentation, I will also attempt to answer some of the questions that we have received during the course of the week. If I could just be allowed to share my screen. Apologies. So the COVID-19 vaccination certificate of South Africa currently can be downloaded through a web portal. So the first thing that you need to do is to open your internet browser. You can, it is functional on any of the internet browsers. It's either Google or Firefox. But before you start, I think it's important that we just look at a few things in order to prepare for downloading your vaccination certificate. First of all, the vaccination certificate can be downloaded by anyone who has received a COVID-19 vaccine in South Africa, and your records has been captured on the electronic vaccination data system. And the electronic vaccination data system, the moment when your vaccination is captured, creates a medical record. And if your information is on the electronic vaccination data system, you will be able to download your COVID-19 vaccination certificate. Now, during the process, we all know that there's been a process in order to be able to access your vaccine. First of all, there's the registration where you would indicate your personal details, and then you go to the vaccination site. They verify your details. They can change some of the details if need be. And after you got vaccinated, you receive an SMS with a vaccination code, with a message that says, please keep this safe for possible future use. So the future use is now. So before you start, apologies, before you start with the download of your vaccination certificate, you need to have three things with you. The first thing is your ID document that you used when either when you registered or when you went to the vaccination site. So this can be your South African ID, it can be a foreign passport, it can be the asylum seeker or refugee permit. And it is important that you note that this is the same document that you presented when you got vaccinated at the vaccination site. You also need the cell phone with the cell phone number on which you have received your vaccination code. And you also need your vaccination code that you have received after vaccination. The first thing is then to type in the search bar of your internet browser the URL, which is vaccine.certificate .health, and then it will pop up automatically. So the URL is vaccine.certificate.health.gov.za. And it will immediately take you to the landing page. So this is the landing page of the official South African COVID-19 vaccine certificate system. You will notice that in the vaccine certificate that you download, that the QR code, there's a QR code printed on the vaccine certificate. At the moment, this is not intended for readability by the general public. This is part of the additional features that will be included. As Minister said, there will be phases of the development and the release of the vaccination certificate. So on the landing page, you would then just click on Get My Vaccine Certificate, provided that you've got all your information with you. So for the purposes of this demonstration, I'm going to use a dummy file. So this is not actual file, and you would go to the portal to say that, sorry, I just want to stop my video. You would go to the port, you would go to this link here. You will select any one of the three options in terms of the identity, as I have mentioned before. Remember, these are the ones that you need to indicate as per the document that you presented when you got vaccinated. For the purposes of this demonstration, I'm going to use an ID number, and then it will take you immediately to the next page. And then I will type in an ID number. Please remember, this is just a dummy ID number, so that we don't expose any personal information on the media and public platform. And then you are requested to put in your vaccination code. So important is that this vaccination code is the code that you have received after you got vaccinated. Usually, or most cases, 98% of the time, you receive this vaccination code within 24 hours after you've been vaccinated. Most people, once their data has been captured onto the EVDS at the point of vaccination, receive this code within 2 to 3 minutes after vaccination. You can use, if you have received the 2-dose Comirnaty vaccine that is manufactured by Pfizer, you will receive, you can use either the code that you have received after your first dose, or the code that you have received after your second dose. Again, I'm just going to type in a code for the purposes of this demonstration. So there's quite a number of questions around, I have lost my code, I don't have the code, I have deleted the SMS, and so forth. So there are two options. First of all, over the next 4 days, today, on Saturday, on Sunday, and on Monday, we will resend the post-vaccination codes via SMS, but it will be in batches over time, just so that we spread the volume over time. You can also phone the National COVID-19 hotline, and I'll give you the number just now, where one of the agents will be able to either give you your code. They will also be able to tell you if there is a record of your vaccination on the EPDS, and they will also be able to resend your SMS with a code to you. So the next one, I'm just going to put in the name. And then there's one last feature, which is the reCAPTCHA feature. And this is just to make sure that this is an additional security feature. And I will click the block. It will turn green once it's on, and then I go to next. So now it asks you the cell phone number. You will see that there's a number here at the top. This gives you a hint to the cell phone number that is linked to your record that you were used when you either registered or got vaccinated. I'm going to just type in the number. And then I will click next. So what would happen then, and this is also part of the security features, just to make sure that not everybody and anybody can download your vaccination certificate, because it's your own personal record. So as to ensure that it's your record and it's your phone, you are able to then receive a one-time PIN on your cell phone, which you then just can type in. I just need to check it quickly. The one that I received is 01305, and then you click next. And then it says the details you entered do not match. Please contact the COVID-19 public hotline on this number. So this is the number, or the WhatsApp support line on this number. So now we, and then you can say done, but then you can just go again. And I intentionally did it so that we know that you can do it again. And it's utmost important that you ensure that you type in the correct details. Otherwise, you will not be able to download the certificate. Sorry, I just now need to carefully type in this folder. So it's 010101 with 6 zeros and a 4. And the proof of the vaccination code is capital CCC, YYY, VVV, XXX. And the name is Jackie. And the surname is, and I'm not a robot. Next. I type in the cell phone number. And then I need to enter the OTP that I have received, which will come through soon, which is 06. Sorry, I just need to open it quickly on my phone. Zero 066960. And I hope I've now typed in all the information correctly. Okay. Apologies, my phone is continuously ringing. I don't know why. I just need to get to the OTP quickly. 06526, and then you can say next. And it again says that it's not matching. I'm going to just go through, apologies. I don't know what's going on. I think it's my phone is continuously ringing, so I might put in the wrong. I'm just going to put in my own details quickly, and to be able, or I can just show you the vaccine. So, okay. So, sorry, Mr. and colleagues, this is how technology works when you're trying to do this. I just want to quickly show you my own certificate. Okay, so I'll put in the proof of my vaccination. Okay, so this is the vaccination code. I made a mistake here. And I'm definitely not the robot. You will see that it matches the hint that I received. Now I must get the OTP, which is the one-time PIN. And then there's my vaccination certificate. So the details that would be on the vaccination certificate, first of all, is your South African ID. The next one is your ID number, then your first name, then your surname, then your date of birth. And then it indicates the vaccine that you have received. Not the manufacturer of the vaccine, but the vaccine that you have received. So the Janssen vaccine is the COVID-19 is manufactured by Johnson & Johnson. And then we also have the Comirnaty vaccine, which has been manufactured by Pfizer. And you will see when you download your vaccination certificate, you would either get your, it would say Janssen, and that's when you have received the Johnson & Johnson vaccine, or it would say you have received the Comirnaty vaccine, and that's the Pfizer vaccine. If you only have received one dose of the Comirnaty vaccine, that will be indicated with the date that you have received the vaccine together with the vaccination code. And if you have received 2 doses, then it would also include the details of the 2 doses. Over the past week, we had quite a number of queries around why there is an expiry date. You will notice that if you download the certificate today, the expiry date that we have put onto the certificate when we were in the testing phase had nothing to do with the vaccine that you have received. It was just the validity date of the vaccination certificate. And we realized that it created quite a bit of confusion. So we have now added it just to say that and indicate to say this is the first version of the vaccination certificate, and that the design of the vaccination certificate will be enhanced over time, and it will and we will ensure that it remain up to date with local and international standards. And you will have to download another certificate as it gets enhanced over time. And as the National Department of Health, we will continuously communicate around the COVID-19 vaccination certificate of South Africa. It's your responsibility to keep your vaccination certificate up to date. And again, at the bottom of the certificate, there's also then the option, again, the reminder to say that the QR code is just being generated and published at this stage, and it's not in a readable format for the general public. You have the option to download the certificate, and you will see here at the bottom that it has immediately downloaded, and this is then, you can save it then. Now, exactly the same process that I have followed for downloading the certificate on my laptop, you can use that with a phone that has got access to the internet, and then save your vaccination certificate on your phone. You can also then email it to somebody to print it. You can save it on your computer to print it, and then you have got the paper version of your vaccination certificate as well. Towards the end of the next 2 months, there will be a mobile app available from where you can then download it on your phone from the mobile app, so that it becomes more convenient to everybody. Thank you very much, and apologies for the glitch earlier. Thank you.
Thank you very much, Ms. Melanie Volmarant. You indicated that we have got a frequently asked question. I'm not sure if you want to quickly run through those, or you prefer to answer the questions that are posed by the members of the media.
I've answered most of the questions during my presentation, Mr. Mohale, and then I will answer questions specifically, if there are any other specific questions. Thank you.
Okay. Thanks for the presentation, Melanie. We believe that it has answered some of the questions that we've been inundated with for the past few days, but we just also want to assure members of the public and the media that we are available. We are going to publicize the communication channels where people can call or to access or get any clarity, or to address all the challenges they experience as far as accessing and downloading their vaccination certificate is concerned. So without wasting any time, I'm going to call upon, as the minister has already announced, that today we've invited Mr. Chipiwa Chibengwa, who's the CEO of a Tourism Business Council of South Africa, just to share with us the benefits of a COVID-19 vaccination program on the sector, tourism sector. As we know that almost all the sectors of the society, the economy, have suffered because of the COVID-19 pandemic. So we're going to quickly take us through the benefits of taking a vaccine in order to open the tourism sector. Over to you, Mr. Chibengwa.
Thank you very much, and good morning, Minister. It's a pleasure to be here, and other dignitaries that are available. I think we're starting the morning with the good news of the UK removing South Africa from the red list, which simply means that there's going to be a flow of travelers between the two countries. But we still have a lot of work ahead of ourselves, meaning that if the travelers don't trust the destination in terms of the vaccination, we're going to have an uphill battle. And for us in the tourism sector, it's quite important that when those that are vaccinated are planning to travel to South Africa from anywhere around the world, they must find the sector that's vaccinated across the value chain to ensure that there's trust and we don't return back to the restrictions that we've seen that are imposed by different countries due to COVID-19. And therefore, for us in the tourism sector, vaccination drive is quite important. And we have seen this with the likes of Sun City having the workplace vaccination for that particular area. We are doing a survey of all our members and non-members within the tourism sector to understand the level of vaccination within the value chain of tourism. And so far, the results that we're seeing are encouraging, and they point to the fact that the industry is really getting on with vaccination. For us, it's a matter of getting people back at work, getting businesses to reopen. As I've said, getting the international markets to trust us. When we have all these restrictions, from other countries, it simply means that we're unable to do the work that we do best. So we have been hard at work as a sector to make sure that people take JEB. We have a program called JEB for tourism, and many others within the tourism sector. So for us, vaccination is key to sustain our livelihoods. It's key to make sure that we return to some level of events and conferences in a sustainable way to ensure that we don't see the hospitals being flooded with many people that are infected and cannot be able to, or they will be needing oxygen, going forward. So we are taking this.
Mr. Chivengwa, you are muted.
Okay, I hope you can hear me now. I was saying that we are taking the message of vaccination seriously, and we are driving programs to make sure that we at least reach the 70+% of vaccination among our staff. But for us, 70% as a benchmark is great, but we want to go further than that because of what I said previously. So that is critical for us in terms of getting back to work. And if you look at the tourism industry, pre-pandemic, we're talking about an industry that contributes about 8.6% to the GDP of this country, employs about 1.5 million people, both direct and indirect. And also there's a huge value chain of informal tourism businesses that operates, alongside tourism attractions, people who sell, arts and crafts, people who sell ice cream in the beach, and many other places. So our industry is vast. It has both formal and informal, and it contributes quite significantly in creating jobs in rural area for women. And it ensures that, many people across South Africa put food on the table. So it's a big industry, and the spend that we receive pre-pandemic is around 273 billion rand every year. That comes from both domestic and international tourism. So for us, it's critical that we open up sporting events. It's critical that we open up, the business side of tourism in terms of conferencing, exhibitions. It's also important that we boost domestic travel in terms of corporate travel and government travel. And to do that, we have to ensure that our sector is vaccinated so that everyone can trust the value chain, as I've said. The introduction of the digital vaccine certificate is welcome news for us. It will enable South Africans that want to travel overseas to be able to travel to those destinations that requires them to produce these digital vaccine certificates. And the fact that it's accepted in many countries is key because what has been said by the previous presenter, the issue around trust is important, and we don't want countries to look at us and say, well, but we don't trust your digital vaccine certificate. And I'm glad to see that the security that's been put in the digital vaccine certificate is going to help for those that want to travel outbound to other countries. It will also help us for those that want to go to sporting events or events that may be open for large numbers of those that are vaccinated, because it's going to be critical. If we look at the sporting events, we look at conferences, as I've said, that we need to open those in large numbers for those that are vaccinated so that they can enjoy the benefits of being vaccinated. That will boost tourism. That will boost our sector in terms of getting people that are at home to come back to work. The last time we did a survey with the World Travel and Tourism Council, we know that there's 470,000 jobs that have been lost, or people that are sitting at home waiting to go back to work. That's a huge number when it comes to South Africa and the fact that we have a high unemployment rate. So vaccination will enable us to get this 470,000 people to go back to work, and it will enable us to get those that are back at work that may not be earning full wages to start to increase their wages, because we'll be seeing a lot of demand coming through. So for us, we are hard at work, Minister. As a tourism sector, vaccination is key for trust, as I've said. The digital certificate program is key for us, and also to keep countries like the UK and many others to impose restrictions. Vaccination is key. And of course, we'll continue to follow the protocols that we've put in place, the protocols that the department have put in place, to make sure that we are seen as a destination of choice in terms of COVID-19, and to make sure that we avoid incidents that may find us being or attracting the negative side of the media overseas in terms of our protocol. So we're going to be tightening up. We are looking forward to trading during the December holidays. We want to make sure that we recover on a faster pace, but of course, in a responsible manner, and ensuring that many people that are coming to the country and South Africans that will be traveling their own country do so in a safe manner, and do so observing the COVID-19 protocols. So we are excited about all this announcement, Minister. We are excited about the UK announcement, the digital vaccine certificate, and we hope that as we continue, and as we welcome the guests that will be coming from various places around the world, we strengthen our partnership and relationship. We work together between the public and the private sector in ensuring that as many people as possible are vaccinated. What we can promise you is that we will do our part, and we will continue to increase the levels of vaccinations. And the indications are that we may reach that 70%, hopefully before the end of the year. But we are working together as a tourism industry to ensure that we achieve that. Thank you very much.
Thanks very much, Mr. Chifiwa Chivengwa, for that commitment to work with government to ramp up the vaccinations through your tourism sector. And surely we believe that if working together, we can reach the immunity, herd immunity, or herd immunity. Without wasting any time, I need to emphasize on what my colleague Emiliani has said in terms of for the inquiries, where people can direct the inquiries. We understand that the system is just low. We've just launched the system. It went live, but few people might be experience the challenges. So for all those who be experience challenges, the email, they need to call the following number: 0800 0299 0800 0299, or they can send their emails to evdsqueries@health.gov.za. Email address again is evdsqueries@health.gov.za. We're going to publicize these communication channels through all our platforms, our website, social media, and all other channels, so that all those who continue to experience any challenges regarding accessing or downloading the certificates can be easily accessed or assisted. So without wasting any time, as the minister has said, that today we officially launched this site. We are going to take a few questions from the media, so that we'll be able to address all other questions that have been addressed, that have been raised. So I've received a number of questions through both the WhatsApp and this line. I'm going to read them out for the panelists so that they can be able to assist to address some of these questions. I've seen Dr. Phillips has already tried to respond to some of the questions online, so I'm going to read only those that have not been responded to. So the first question reads as follows: is the live already ready to enable people to download their certificates as of now? I believe that has been already answered, but the people, if they experience the challenges, they must feel free to call those numbers that are given out. The second question is, what measures are in place to avert any form of fraud or hacking of the system? As we know that other people try to take chance to disrupt this a smooth process that is assisting the government to ramp up the vaccinations and also to enable the tourists and other people to travel to go other places where this certificate is a mandatory. So what are the measures that are put in place by government to prevent any form of forgery or hacking of the system? The third question is, will these certificates, as the minister has already announced that the UK has announced that they will recognize this certificate, but the question is, will these certificates be recognized globally apart from the UK? Will other countries recognize our certificates apart from what the UK has already announced? The fourth question is government in talks with Moderna to get them to set up production facility to produce vaccines in the country? The fifth question is, when will the dedicated QR scanner be released in the country? The last question is, how do I get my vaccination number? I've received these questions several times. The people who have say they can't retrieve their numbers, others they've lost their cell phone numbers. As we know that every time when you get vaccinated, the system, the EVDS automatically send you an SMS to confirm that Foster Mpale, you have successfully got vaccinated with either J&J or a Pfizer. So at the beginning, at the end of that SMS, there is a reference number. So there are people who say they've lost their cell phone numbers. Others say that message has been deleted by error. So the question is, how do they retrieve that number so that they can be able to access their and download their certificates? The last question is from Heidi Jokos from ENC. Is government able to provide data of the efficacy of the vaccines? We have over 5,000 people in hospital due to COVID. We have statistics of how many are jabbed and how many died after being jabbed. I'm going to hand over to Minister and other members of the panel to assist in answering these questions. Over to you, Minister.
Well, thank you very much, Foster. I think, sorry, a lot of the questions are on the certificate. I'll ask the team to deal with that. Just a few which I've seen. Also, the efficacy studies. There haven't been formal studies, but sorry, I'll ask Dr. Crisp just to help me with that one. I know that there has been some kind of informal reports in terms of the number of people in various hospitals. The Groteskir, for instance, did give some numbers of comparison between people who are in hospital who are vaccinated and those who are not. I think all that we need to do would be to formally collate that information. It shouldn't be very difficult. I'm not aware of any formal report, but I'll ask the acting DG just to speak to that. There was a question also about the plan to whether there are any plans to vaccinate children. We are aware that SAPRA has approved the Pfizer vaccine for usage for people under the age of 18, I think between 12 and 17. They've given that approval. Now, what we are doing at the current moment is really just to plan around that. We do have plans which we will announce. We're following our risk-adjusted approach as we have been from the beginning of the vaccination program. That's why even in my report, I emphasized our focus on the more vulnerable older age groups. We want to make sure that we focus on that as much as possible, but we will make announcements before the end of this month in terms of plans to then, as we have more coverage of the adult population, and especially your 50 plus and 60 plus, as we get more coverage of that, of the older age groups, we will be making announcements in the next few weeks or so, before the end of this month, definitely, in terms of when we can move into the lower age groups, below adult, below 18. So those announcements will be made. I'll ask Foster, let's get the team, acting DG, Melanie, and other team members to deal with the technical issues around the vaccination certificate. But acting DG can also add on the efficacy studies. Thank you.
Morning, Minister. Morning, Deputy Minister, colleagues, media, viewers. So as far as efficacy is concerned, we have been collecting information from all the provinces, and they have been publishing the vaccinated people versus unvaccinated who have been hospitalized, who are in high care and in ICU. And it differs a lot from one place to the other. As we've heard, there were times at Groote Schuur where of everybody that was in hospital, particularly in ICU, not one was vaccinated. They were all unvaccinated. We've been following countrywide to see both in the public and the private sector to track the trends. We are still busy with more detailed analysis because one wants a 7-day moving average to see if there's consistent patterns, and that's being looked at. But so far, countrywide, less than 20% of people who are hospitalized, and particularly in ICU, are vaccinated. And that includes those who have had only 1 dose of vaccine. And we know that with the Pfizer vaccine, you need to have 2 doses to be protected from severe illness. So we're busy with that analysis too, to see what is the time period between the vaccination and the admission for those who were vaccinated, whether they had 1 dose or 2 doses, whether there were patterns that we might miss on comorbidities and other issues. So it's not as clear-cut as it looks. This week, we were looking at figures from Limpopo at all of their hospitals. And once again, the figures, there was 1 hospital where none of the admitted COVID patients was vaccinated. So I think the consistent pattern is that vaccination definitely protects you from illness that results in hospitalization and in particular intensive care. But one needs to be very careful to get more detailed analysis before making just general statements about it. So I think as soon as we have that more detailed analysis, we'll put it into the public space. I'll leave the answer at that one and let Melanie answer the technical details on the.
Thank you, and thank you for the questions. In terms of the current version of the vaccination code, this is a digital version of your paper-based card that you have received. And in terms of the availability of the QR code in its readable form, I think our plan is to, by the latest, release it before the end of October, and we will communicate accordingly. So that then the QR code will have the cryptographic signatures that is then linked to the PKI infrastructure, which is the public and private key infrastructure, that would then prevent any fraudulent production of any vaccination card. And that would be the official vaccination card with all the securities linked to that. In terms of the security, we have got a cybersecurity specialist that is working with us to ensure that we are putting as stringent as possible security measures in place. And we are working and protecting personal data as far as we possible can, and not sharing the data with anybody. And also with regards to your vaccination record, we've got regular penetration testing cybersecurity specialists that working with us to ensure that we protect and that we improve security, as it is a field that continuously changing, and therefore we need to be up to date continuously. With regards to the recognition of the digital vaccination certificate in other countries, most of the countries in the globe would accept the digital vaccination certificate. It is, however, dependent on the policy of the country that you would be visiting and also what their verification requirements would be. So towards the last version of the vaccination certificate is where we will then start to share some of the security codes to be able to allow for different countries to do different verification. And this is when we talk about the public key infra or the PKIs, which is the security codes linked to the cryptographic signatures. I'm trying to make it very simple, but it is a huge complicated technology platform that we are creating, ensuring that we are adhering to international standards. Thank you. I think I've answered all the questions. Oh, there was one, if I could just add to what Foster has said. The one is that, as I've indicated, that if you have lost your SMS, you can immediately, or you can phone the hotline and they will be able to produce they will be able to send you the SMS immediately, or they will be able to provide you with your vaccination code. If you haven't received the SMS, we also recommend that you phone the hotline first, because they will be able to determine if there is a vaccination code for you against your ID, and they can then give it to you. There's 3 reasons why possibly you haven't received your SMS. Maybe it didn't reach you due to there was maybe some mobile network issues at the time. And then one of the key issues is that your vaccination record might not have been captured on the EVDS, as they might have used a manual paper-based form. And like I said, you can phone the hotline to determine if that has happened, if there is a record on the EVDS against your ID, and then provide you with a code. If they cannot confirm that, you can communicate with us via email, and then we can advise you.
Thanks, Foster. It looks like Belani is having a problem with the bandwidth. Can I ask Dr. Crisp also to deal with, there was a question about Moderna, whether Moderna has any plans to set up plant in South Africa. Can you also just attend to that?
Yeah, Minister, thanks very much. So what we're aware of is that Moderna has put out a press statement that they are looking at 5 countries in Africa. They have not made any decision. We know where some of those countries are. When they engage with South Africa, they will not engage with the health department directly. This is a terrain of the Department of Science and Innovation, who is also involved in the other vaccine plants in the country. And they will obviously, in due course, when there's something concrete, then they will share that information with us, to the extent that the health department might need to be involved. But the mRNA hub, which has previously been announced and is a project that is going on between various companies and supported from outside of South Africa, is going to be one of the potential places that Moderna might want to talk to. So we, from the health department, are not directly involved in the manufacturing of pharmaceuticals. We don't like to get involved in conflicts of interest with that kind of arrangement, and we will wait and play our part from the health department on the periphery once there's something clearer from science and innovation. Thank you.
Back to you, Foster. I think the team has answered the existing questions. Back to you.
Thanks, Minister and members of the panel who assisted with those questions. I've got the last 2 questions before we take the Deputy Minister to do the wrap up. The question reads as follows: what is the waiting period for the system to generate certificate after being vaccinated? So the question simply says, can I vaccinate now and immediately access my digital certificate, or is there any waiting period that I have to comply with before the system can generate a certificate? The other question is, can I re-download my digital certificate more than once in case I lose the first certificate? Is it a once-off process, or I can download as many times as possible? Thanks, Minister and colleagues.
Melanie, you're muted.
Apologies. First of all, you can download your certificate immediately after you have received your SMS confirming your vaccination with your vaccination code. So there's no waiting period. And secondly, it is possible to download your vaccination certificate more than once. We have just put a little bit of controls in because we found during the testing period where people were downloading it up to 50 times. I don't know if they were trying to test if the system will fail over, but that then creates for other people some challenges. So there is a limit of 3 or 4 times a day that you can download it, but there's no limit in terms of how many times you can download it. Thank you.
Foster, if I can just add one thing, please. So we must remember that people who are being vaccinated with the Pfizer vaccine, the Comirnaty vaccine, will get a second dose. And in future, there may be booster doses. And in a number of instances, there are medical indications for additional doses and so forth. So what we will see is that as those additional vaccines are given over time, you will need to refresh your vaccination certificate to reflect those vaccinations. And this vaccination card now makes it possible for us to add other vaccinations, which may be part of a vaccination schedule going forward. So it's a platform in which we can capture more information in the future. So obviously you would want to increase to get a new card when that happens. Thank you.
Thank you, Dr. Crisp and Melanie. The last question is someone from Rwanda. I don't know whether from Rwanda or he says he has received the first dose in South Africa, the second dose in Rwanda. So how can this person access certificate? As you know that one of the doses is not registered in the country, but it's only registered in Rwanda. So how can this people like this one access their certificates?
Okay, thanks. So I'll take this and Melanie can provide the technical details. So we are only capturing vaccine doses that are part of the national program and the research studies that are done in South Africa, like the Sisonke study. Those are formally part of our agreements with the Medical Research Council and the formal part of the national government's vaccination program. So any vaccine dose that is given to anybody in any other country, and there are many, there are travelers who come to the country with vaccines that are not available in South Africa, are not captured on our vaccination certificate. What that would mean is the person who has had a vaccine dose elsewhere, whether it's as a first or a subsequent dose, will need to have 2 vaccination certificates. They will have ours for any vaccines that are administered to them as part of our system, and then they will have another vaccine certificate that is provided by the country where they were vaccinated. Thanks.
Melanie? You are muted, Melanie. Melanie, you are muted.
Yes, thank you, Foster. We can only reflect on the vaccination certificate, the vaccinations that has been recorded on the electronic vaccination data system. We cannot reflect on the vaccination certificate any vaccines that has not been part of our recording system. Thank you.
Thanks, Melanie and Dr. Chris. Before I take the Deputy Minister to do the closure, I'm not sure if Minister wants to add anything before?
Well, thanks a lot, Foster. No, mine is just to really thank Mr. Chivenga for coming on and really, adding a lot of impetus in our drive for the vaccination. We appreciate his participation. Otherwise, nothing more to add. I'm sure the Deputy Minister can give us his remarks. Thank you, Mr. Foster.
Thank you, Minister. Without wasting any time, I'm looking at the time. I'm going to hand over to the Deputy Minister, Dr. Sibongiseni Dhlomo. Over to you, Doc.
Thank you very much, Mr. Mohale, and good morning to our Minister. I will start from where our Minister has ended, and good morning to all our viewers. Thank you to Mr. Chivenga for accepting our invitation to come to this briefing, because he has shared quite a lot of very important points. I'll just mention the two that he actually mentions this, that South Africans, please, the vaccination is a gateway to opening up all opportunities of tourism, be it domestic or international, sports events, cultural events, exhibitions. He further made a mention of about 170,000 South Africans who are technically employed but are not able to go to work yet until and unless we have opened up those opportunities that where they were working. And we thank you, Mr. Chivenga, also for welcoming this breaking news announcement and demonstration by the National Department of Health, by the Minister, assisted by Miss Melanie Wolmarans. All I could remember there was that please, South Africans, just take this number in case you still get frustration, 0800 029 and 999. And then Mr. Mohale, I'm sure in his closing remarks, will mention other sophisticated link in internet. South Africans, the minister in his address, I'm sure you probably, let me just say, in the past 2 months that the minister has been coming to this platform, has never announced a shortage of vaccines in the country. So that part is not one of the problems we face in the Department of Health. What we do have a challenge in is accessing the arms of South Africans to get the vaccines. And we are aware some of the South Africans are just saying, okay, there's enough vaccines. Okay, I can postpone, I'll do it next month and next week. And there's a real urgency from our side, was, as the minister indicated, if we could vaccinate as many of our South Africans before December, we would then, like today we are at 33%, we would then be very close to this 70%. We should then support our view that is given by the scientists that we will then be very much safe from a fourth wave. So we request that minister is making an announcement of Vuma weekends. Maybe we should also say, can we have Vuma days, that every day becomes a Vuma day, that all of us are encouraging one another to go and vaccinate. We are very happy with the announcement made by a minister that the senior citizens in our country are really going that they are very close to be actually fully vaccinated, close to 70%. And then we really encourage all our South Africans. So in short, South Africans, I pick up that the department is at work and we are really pleading with South Africans to come forward. We want to look like other countries in terms of opening up tourism, entertainments, and then it depends on us accessing the arms of South Africans with the enough vaccines that the minister always says we have. Thank you very much, Mr. Foster. Maybe you could add those sophisticated other contacts, because we really want South Africans to take charge of what Melanie has just indicated. We all want to vaccinate, but we also want to actually get this vaccination certificate. It's a real icebreaker for today, and we are excited about it. Thank you very much.
Thanks, Deputy Minister Dr. Dhlomo. Just to emphasize those contact details for now, the COVID-19 hotline is 0800 02 999. The email address is evdsqueries@health.gov.za. We are going to publish more other contact details through other platforms, the website, the social media platforms of the department during the course of the day, so that we'll be able to allow people to use different channels of communications to raise all their issues. Just to, as my closure, I just want to emphasize that the digital certificate is not a license for people to drop their mask, to ignore the non-pharmaceutical interventions, social distancing, sanitizing, washing hands, and ensuring ventilation in all the spaces that they spend more time. So it's just an enabler for people to access areas and the places where the vaccination, the proof of vaccination is a mandatory. So we encourage members of the public to continue observing all the COVID-19 protocols so that we'll try to disrupt this virus to also to get ready for the fourth wave, so that by the time the fourth wave hit us, majority of South Africans would be vaccinated. We are not going to experience as many deaths, as many hospitalization requests as possible. Just before I close, I'm going to check with the minister if I want to have the last parting shot, Minister.
Well, thank you very much for your generosity, Mr. Mohale. Well, mine is really finally just to thank all the role players on this media briefing, the DG, the Melanie Volmarans, Deputy Minister, Mr. Chivenga, and everybody, and to say indeed, it is in our hands, and we can't get back the South Africa we want if we can all come forward, and we've got the capacity. We are ready for all citizens to come forward and receive their vaccines and also receive their certificates. Thank you very much.
Thanks, Minister, for the parting shot. On that note, I'm going to declare this media briefing agenda until we meet again next week or next time. Thanks for the members of the media for their continued support, and all other members of the public for supporting us by complying with the COVID-19 protocols. Until we meet again, let's continue observing the COVID-19 protocols. Thank you.
Thank you, sir.